The availability of data has revolutionized our lives, changing the way decisions are made everywhere from advertising and automobiles to dating and baseball. Airplanes have always relied on that detailed information, of course, storing it in the flight data recorder, where it can be synthesized and studied, especially after a crash. Now, in an effort to make their critical work safer and more efficient, hospitals have come up with their own version of that black box. NBC medical correspondent Dr. John Torres explains in our Sunday Spotlight.
On every commercial airplane in the United States is a bright orange device. Despite its neon color, it's known as the black box. It records what happens during a flight, and its data is essential to passenger safety. Now, for the first time, it's being taken inside the operating room to see if it can also save patients' lives. I'm here in the first hospital in the U.S. to use this Big Brother technology.
Here are one of the cameras.
A bold experiment to reduce medical errors, which are right behind heart disease and cancer as America's big killers.
Oftentimes people assume medical errors are the fault of an individual, but the system has cracks in it.
A Canadian study on the OR black box finds there can be quite a bit of noise and distraction that interrupts surgery. During the average minimally invasive procedure, a pager beeps 6 times, a door closes 42 times, and equipment alarms go off 67 times.
Patients don't just die from surgical complications, they can die from communication breakdowns and handoff failures.
That's why cameras and microphones mounted around the OR collect data on a wide range of things that can impact health outcomes. Everything from the patient's vitals to room temperature. And after just a few months with the black box in their operating room, this team has made some important discoveries. Have you had any surprises?
Oh yeah, you didn't realize how often people are coming in and out of your operating room, how often the telephone rings, how often you're being distracted from working on what you're supposed to be working on.
Even music being played during surgery, which seems harmless and has been going on in operating rooms for decades, is now being recognized as distracting.
I know some of my surgical colleagues will be very disappointed about that, but I think that if the data continues to show that, music may be banned in the operating room.
One of the big questions, can patients use the recordings in court? Northwell claims the data is protected from lawsuits, but not every doctor believes that.
There's been a lot of pushback about this and a lot of fear.
But enough doctors see the potential advantage of real-time black box data, and the hospital is in the midst of a study to analyze the impact it's having on their surgeries. And already, it's giving some patients peace of mind.
I like the fact that the doctors are being watched, monitored. I do feel more secure, safer.
Full length, cleared to land.
A lesson from the aviation industry in the operating room, reducing errors and saving lives. For Sunday Today, Dr. John Torres, New York.